everybody, it's Dr. Jo, and today I have a special guest with me, Dr. Jen,
Hi.
and we're going to talk about low back and pelvic pain during pregnancy. So let's get started. Disclaimer alert, disclaimer alert. So Dr. Jen specializes in the pelvic floor. So this is awesome. That's why she's special. She's actually just a cool, special person anyways. But she's also pregnant. Like, it's not really fair for me to tell you what to do, but she's going to tell you what to do. So tell me a little bit about what you do in general.
So I am a pelvic floor physical therapist, and what that means is I specialize in treating bowel, bladder, and sexual dysfunction in men, women, and little kids. And that includes the pre and postpartum population. So I see a lot of women who are dealing with pain, urinary or bowel issues during and after pregnancy.
So a lot of stuff.
Lots of stuff.
Lots of stuff.
Yeah.
So today we're going to talk about low back pain, pelvic pain during pregnancy, because I think you kind of know about that.
Yes.
Right?
Yeah,
Yep.
absolutely.
All right. So let's get started. Tell me some things that you experience in general being pregnant and those ailments and what you need to do to fix them.
Perfect. I think I speak for most women in their third trimester when I say that there are a lot of changes that happen in your body. So some of the first things that change are your hormones. So your hormones are shifting all over the place. And during the first and third trimester is when those hormones are the most variable. So you may see a woman who has barely gained any weight but is complaining of significant low back or pelvic pain because she has a special hormone called relaxin moving her pelvis to get ready for baby. And then that happens a whole lot more in the third trimester. So those hormonal changes will cause some pain in general, but the next biggest problem during your third trimester is postural changes. So the weight of the baby, as well as the weakness that occurs in your belly and your bottom, changes the way that you stand and then the way that you transition. So all of a sudden you're experiencing pain as you get out of bed, bend over to pick up a child, tie your shoe, you name it, it all hurts because our posture has changed.
All that weight shifts forward.
Yeah,
What?
yeah, exactly. So what we want to do today is talk about how you can bring that back to what we would call a neutral posture to help calm down your pain.
Awesome.
Yeah.
All right. So you're going to show us some stuff?
I'm going to show you guys my top 5 exercises for
Awesome.
low back and pelvic pain during pregnancy. I just want to mention that these exercises are a balance of both mobility and stability. So we do want your pelvic girdle to move, but we want it to move safely and we want it to move pain-free. And then the next category of exercises that we do are stability, or what we call control exercises, to where you can get your body moving in a pain-free range and stable in a pain-free range.
Cool.
So the first thing that I want to do is I want to lie down. Now, all of that to say, if you are a bigger lady who's having a harder time lying on your back, there are lots of modifications. You can grab a seat on the edge of the chair. You can prop yourself up on a ton of pillows. But in general, it is safe to lie on your back for short periods of time in the third trimester. So that's where I want to start today. So I'm going to go ahead and lie down on my back and show you both a mobility and a stability exercise.
All right, we're going to switcheroo here.
All right. Oh, apologize.
Oh.
It's part of it, ladies.
See, it's real here. It's not just me with a basketball underneath my shirt.
It's part of it. Okay, so in a relatively relaxed position with your hips and knees bent and feet flat, what I want you guys to do is connect to your pelvis and your low back. So the first direction that we really emphasize movement is in what we call a forward and a backward direction.
You can see how she's coming kind of up and down with her belly there. That's pretty cool.
Yeah. This should be pain-free, and initially your movements may be very, very small. So for example, a woman who's having excessive pain at 39 weeks may only be able to move this much, but any movement is better than nothing at all. It really is lubrication for those joints. A woman who's earlier in her pregnancy may be able to excessively arch and then round and tuck that bottom under, okay? But I really want the movement to come from the low back and the pelvic girdle, okay? So I usually have patients do about 5 to 10 in each direction and trying to maintain normal breathing during the movement.
So Dr. Jen, while you're doing this, if you have a little bit of increased tightness, maybe slight pain in the beginning, but it then decreases, is that okay?
That is a great question. Absolutely. It may be slightly uncomfortable at first.
Yeah.
Absolutely.
Because you're tight in there. Awesome.
Easy peasy. So we call this an anterior or posterior pelvic tilt. Once you return to the middle,
just pointing to where the pelvic tilting is going on.
Once you return to the middle, as silly as this exercise may seem, I want you to move your pelvis in a side-to-side direction. So imagine for a second that you're going to draw one side of your pelvic girdle up towards your armpit and then bring it back to that neutral spine. Draw the other side up towards your armpit and then come back towards the middle. Again, moving through your range comfortably, and by the end you really should feel as if you've gained a little bit of mobility.
So this is sometimes something that you can do on a Swiss ball as well. Would you do it while you're pregnant? Because a lot of times with low back pain, I'll have people get on a Swiss ball or a therapy ball.
Absolutely. So if you don't have a stability ball, which is a wonderful option for this exercise, you can always sit on the edge of your chair with your back unsupported. So if lying down is problematic, if you have difficulty catching your breath, then get on the edge of the chair and you can do this exact same exercise in your pain-free range of motion.
This is the one I call the Shakira because the hips don't lie.
Yes, yes. It is true. It's true. So let's pair this with a little bit of stability, shall we? All right. The core is made up of 4 muscles: diaphragm, pelvic floor, transversus abdominis, and our deep multifidus or low back muscles. And they should function beautifully together to stabilize the spine and pelvis prior to movement. And so what I want to do is I want to have you ladies connect with your core. And so I don't know what cues you give your patients, but you can just imagine that you're gently drawing your baby back towards your spine. You see subtle flattening of my low back. I'm able to hold and maintain normal breathing, which is key.
Yes.
If you have to hold your breath, you're not doing it right. So I have patients take a big deep breath, nothing happens, setting up the exercise. And as you exhale, gently draw that baby back towards your spine.
Goes down in there.
Hold, hold, and relax. It's a pretty dramatic difference when you're in your 3rd trimester. You can really see your abs activating. If that cue doesn't work for you, you can imagine that you're going to tighten your inner corset, zip up a tight pair of pants, but regardless, minimal movement of the spine and pelvis should occur. And relax.
And I tell people that this is all happening here, so you're not pushing with your legs, right? It should all be in that core and that pelvic area. So if you feel like you're pushing down with your legs or your feet are sliding, you're probably not doing it quite right.
Absolutely. Let's say, ladies, that you're experiencing a little bit of urinary leakage when you cough or sneeze or lift or laugh during pregnancy. This is a great way to start incorporating your pelvic floor into your routine. So the abs should fire and are best friends with your pelvic floor. So now imagine, for example, that you're inhaling and nothing's happening. As you exhale, you pull that baby back towards your spine. You won't be able to see this, but gently lift from the bottom of your core as if you're holding back gas or urine, and let go. And trying to connect with those muscles is key. This is the basis for returning to exercise after pregnancy. It starts here, and then we translate to jumping, bending, jump roping, lunging, squatting, you name it. But you have to master it in a pain-free position here. So again, I inhale, nothing happens.
Okay, right there.
Exhale, pull belly button to the spine. Lift as if you're holding back gas, continuing to breathe and relax. Always making sure that after a contraction, there's relaxation.
Nice.
Can we progress?
Yeah, let's do it.
Okay,
All right.
awesome. So, Dr. Jo, there's a huge muscle group in the back of the pelvic girdle that stabilizes your SI joints, but also helps to lift your hips, and that is glutes. So these muscles are key in preventing low back pain because they stabilize from the backside. So we are going to add on to our basic core contraction, which was abs in, pelvic floor lift, and now that movement is going to occur. I'm going to squeeze my tushy as I lift up, continuing to breathe and come back down. This is awesome. at the end of the day when you're feeling excessive pressure in your belly. Like everything is being pulled down. You can do a gentle inversion. So inhale, belly gets big. Exhale, pull that baby in, lift the pelvic floor, activate those glutes, continuing to breathe, and come on down. Easy, easy exercise. If it's painful, you do not have to go nearly as high. You can really just get those glutes firing and come up in your safe range. If you're feeling good, go ahead and activate, lift the pelvic floor, and come up a smidge higher. I really want you to feel those muscles firing in the back because they do play such a huge role in stabilizing the pelvis. I usually have patients do to tired, just enough to where you feel like your bottom muscles are really firing and getting a little tired. And then that's it.
Sweet.
Cool?
Squeezing booty muscles.
Do it.
All right.
All right, let's change positions and I'm going to show you 2 more things, okay? For my last 2 exercises, I want to change positions a little bit. So I want you to know that that basic core exercise you can do in any position, seated on the edge of the chair. Why don't you try it while you bend over to pick up your baby carrier? All of those really basic exercises can become very functional. And then, like I said, you can get back to running and maintaining normal core activation because you've mastered it and trained your brain to use it appropriately. So at the end of the day, when the back is really feeling strained or those sacroiliac or SI joints are really feeling irritated, a great position to get in is quadruped or all fours. So I'm sure you've seen this with Dr. Jo before, but what I'm going to do is I'm going to prop onto my hands and my knees and I'm going to mobilize my spine and pelvis just like I did lying down. The beauty of this is that gravity is really going to help and you'll get a little resistance to help through that range, okay? So I'll go ahead and demonstrate. I'm going to place my wrist directly under my shoulders.
You guys have heard that before.
My knees under my hips. And what happens first and foremost is gravity kind of pulls and my belly drops, and this actually is quite relieving to get the weight away from my spine. So I can just hang out here and breathe, rest, and get a little bit of relief from low back pain. But I do challenge you to find that neutral spine where I've activated my core just subtly, okay? And what I want you to do is really work through that range because we want the pelvis to be mobile and pain-free. Remember that. It should move, but it should be pain-free and you should be in control. So as I just inhale, I'm going to just gently let my tail go up towards the ceiling, my belly drop down towards the floor, getting that excessive arch. And then with my exhale, I'm going to round up, pushing my belly button up towards my spine, trying the best I can to get some length in the low back and gluteals. In general, as pregnant women, this is where we live. From postural changes, the weight of the baby, laxity of the ligaments like we already talked about. So we really have to challenge ourselves to be here. And then this is the opposite direction, which provides that stretch and that length in the low back and gluteals, okay? So again, I'm just going to start pairing that with my breath slowly in my range. It can be as exaggerated as I'm doing now, or it can be as subtle as something like this. Again, about 5 to 10 times in each direction, moving my pelvic girdle. And then I'm going to come back to neutral. So remember that lateral pelvic tilt I taught you when you were sitting down where you draw one side of your pelvis up into your armpit? We're going to do that same thing here and it looks absurd. So I call this wagging your tail or Shakira. But imagine for a second you're drawing one side of the pelvis up. I'm getting length on the left side of my low back and I'm tightening the right side. Coming back to neutral. Drawing the left side up, getting length on the right side of my pelvis. And then coming back to the middle. Again, it can be a subtle tail wag. You get a shy dog. Or it can be a really happy tail wag.
That would be Bear.
That would be Bear, yes, exactly. And then come back to neutral. So for the last pose that I was talking about, the restorative pose, I want Jo to demonstrate because early in your pregnancy you may be experiencing low back pain and that is not uncommon. And you'll be able to do this exercise a little bit easier than somebody who's in their 3rd trimester. So the point of child's pose is one, relaxation, but also to get some length in the back of the spine and the glutes. So Jo has sat her bottom back onto her heels and now all you're going to do is reach your upper body forward, feeling a good pull in the upper, lower, and gluteal region, okay? So you can stay here and spend about 2 to 5 minutes breathing, okay? This is a wonderful position to just get some length in the low back for a prolonged period of time, okay? And then go ahead and come on out of that. I'm going to show you a modification if you're experiencing a large abdominal girth in the way. So I'm going to scoot over just a little bit and grab a pillow. You can fold it up.
With the dog hairs on it.
Separate the knees wide because we do have to make room for the belly. Bottom's still back on the heels. And then I'm slowly working myself forward. Turning my head to the side, but still trying to get the length in the low back. Breathing and sitting back into that stretch as I can. Again, should feel really, really great, beginning, middle, or end of your pregnancy. Like we talked about, you may not be able to get in this position. Getting down on the floor might be a little bit of a challenge for you. So, seated on the edge of your chair with your knees wide, you can just gently lean forward, trying to get what we call flexion in the low back and the gluteals. So there's some good modifications as we go. The other great thing about child's pose is you can start to connect to your pelvic floor. As you prepare for delivery, we want your pelvic floor to start to relax and open. So while you're in child's pose, focusing on your breathing, you can do that small, subtle squeeze. Feel the pelvic floor come back down and live there so that your body can get to know where it needs to be during delivery. So a little trick of the trade there. One thing that I do want to mention that Dr. Jo pointed out was breathing. Breathing is everything. If you are holding your breath, you're doing the exercise incorrectly and it's not functional anymore. So I generally will tell my patients that as you inhale, nothing's happening. You're really just setting up the exercise. But all of the power from your core and the movement is coming with your exhalation. So when we were on our back, we inhaled, belly got big. We pulled those abs in with our exhale. We lifted the hips. And that should translate from squatting, bending over to pick something up, deadlifting, you name it.
Nice.
Cool?
Cool.
Those are the 5.
All right. So I had asked you earlier, is there anything that you shouldn't be doing while you're pregnant? Certain exercises, certain movements?
That's a really great question. So in general, if it hurts, you want to find a way to modify it. So whether you're experiencing pain in the front of the pelvic girdle, the back, generally excessive movements of the leg and the pelvis can be a little bit too much. So think about getting in and out of your car and really swinging that leg around. You're going to want to modify and limit that because you do have that laxity. But in general, if you were an active exerciser or performing even recreational exercise prior to getting pregnant, you should and can continue that all during your pregnancy.
Cool.
However, if you get pregnant and that is your motivation to start an exercise program, don't do it. Find a physical therapist, whether they specialize in the pelvic floor or general orthopedics, and have someone take you through safe exercises because when you get pregnant is not the time to start a new exercise routine. Lastly, if you're having any difficulty breathing, primarily on your back, get off your back, okay? So use common sense, be smart, but stay active and moving. This is a great time to connect to your body and get your core a little bit stronger.
Awesome.
Oh, no contact sports, no scuba diving.
Right.
Yeah.
Because you just float back up.
Right. I think those are the only 2 big things that you need to avoid.
Right.
Yeah.
And it's very important to go see your physical therapist, even if it's just for an evaluation, because someone like Dr. Jen is going to give you all that information and make sure you're doing it correctly. Even if you just go one time, then at least you know you're doing it the right way instead of just doing it. So,
absolutely.
Yeah.
Absolutely.
So there you have it. Those were some exercises for low back pain and pelvic pain during pregnancy. So if you'd like to help support my channel, click on the link above. And don't forget to subscribe by clicking right down there. And remember, be safe, have fun.
Yeah.
And I hope you feel better soon.